Here's something most people don't realize. Your liver is working harder than any other organ in your body right now. It's filtering toxins, processing nutrients, managing hormones, balancing blood sugar, and it's doing all of this silently. But what happens when your liver starts to struggle? What are the warning signs your body sends you before damage becomes severe? Think about this for a moment. Non-alcoholic fatty liver disease affects approximately 1 in 4 adults worldwide. That's hundreds of millions of people. Yet most people have no idea their liver is accumulating fat until significant damage has occurred. The liver doesn't have pain receptors like other organs. It doesn't scream at you when it's under stress. It whispers through subtle symptoms that most people ignore or attribute to something else entirely. So how do you know if your liver needs help? What are these silent signs that your body is desperately trying to communicate to you? First sign, persistent fatigue that doesn't improve with sleep. You wake up feeling tired. You push through the day feeling exhausted. You assume it's stress or age or just life being life. But here's what's actually happening. Your liver produces glucose, the primary fuel for your cells. When your liver is congested with fat and struggling to function optimally, it can't maintain stable blood sugar levels. Your cells literally run out of fuel. Energy crashes happen because your liver, your energy factory, isn't producing the glucose your body needs consistently. And it's not just about energy production. Your liver also processes hormones that regulate sleep and energy, like cortisol. When your liver is burdened, hormone regulation becomes inefficient. You might experience afternoon crashes, unstable energy throughout the day, difficulty focusing, all because your liver can't keep up with its metabolic demands. Second sign, brain fog and difficulty concentrating. This one surprises most people because the connection isn't obvious. But think about it. Your liver filters toxins from your bloodstream. Every single molecule that comes from your gut passes through your liver before reaching your brain. When your liver is compromised, toxins that should be filtered out can circulate to your brain. The blood-brain barrier isn't perfect. Certain toxins can slip through, especially when liver function is compromised. Ammonia is a prime example. Your liver normally converts toxic ammonia into harmless urea, which your kidneys eliminate. But when liver function declines, ammonia levels can rise, and elevated ammonia directly impacts cognitive function. Brain fog, difficulty concentrating, forgetfulness. These aren't just symptoms of stress or aging. They can be early warning signs that your liver's detoxification capacity is compromised. Third sign, digestive issues that don't resolve with diet changes. Bloating after meals, constipation, diarrhea that alternates with constipation, gas. These symptoms often point to liver dysfunction. Here's why. Your liver produces bile, which is essential for fat digestion. Bile emulsifies fats, so your digestive enzymes can break them down. When your liver is sluggish or congested, bile production becomes insufficient, or the quality of bile becomes poor. The result? Fats don't digest properly. They sit in your intestines, creating bloating, discomfort, and malabsorption. Poor fat digestion means you're not absorbing fat-soluble vitamins like A, D, E, and K. You're not absorbing essential fatty acids, and the undigested fats can feed unhealthy gut bacteria, creating further digestive chaos. Fourth sign, unexplained weight gain, especially around your midsection. This is perhaps the most frustrating sign for many people. You're eating the same amount, maybe even less, exercising the same or more, but the weight keeps creeping on, particularly around your belly. The connection to fatty liver is this. When your liver accumulates fat, it becomes less sensitive to insulin. Insulin resistance develops. Your cells stop responding properly to insulin signals, so your pancreas pumps out more and more insulin to compensate. Elevated insulin is a fat storage hormone, particularly around the abdominal area. High insulin levels tell your body to store fat, not burn it. They also increase hunger signals and make it nearly impossible to access stored body fat for energy. So you're trapped in a cycle. Fatty liver leads to insulin resistance. Insulin resistance leads to more fatty liver. The weight gain becomes both a symptom and a contributor to the problem. Fifth sign, skin problems that persist despite topical treatments. Acne, rashes, dark patches, itching. These skin symptoms often reflect what's happening inside your body, particularly in your liver. Your liver is responsible for processing hormones like estrogen and testosterone. When liver function is compromised, hormone imbalances occur. Elevated androgens stimulate oil glands in your skin, leading to acne. Unprocessed estrogens can cause hormonal skin conditions. But it's not just hormones. Your skin is your body's third largest detoxification organ. When your liver can't handle toxic load, your skin steps in to help eliminate toxins through sweat. But this can create inflammation, rashes, and skin conditions. If you're getting rashes or skin issues despite good skincare, your body might be trying to eliminate toxins that your liver isn't processing. Sixth sign, chronic inflammation without obvious cause. Stiff joints in the morning, generalized achiness, muscle soreness that doesn't correlate with exercise. These are signs of systemic inflammation. Here's how this connects to fatty liver. Your liver produces inflammatory signaling molecules. When your liver becomes fatty and stressed, it can shift toward producing pro-inflammatory molecules at the expense of anti-inflammatory molecules. The chronic inflammation associated with fatty liver doesn't just stay in your liver. It circulates throughout your body via your bloodstream. Joint pain, muscle stiffness, general discomfort, these are how systemic inflammation manifests. And inflammation creates a vicious cycle. It contributes to fatty liver development, and fatty liver produces more inflammation. Seventh sign, blood sugar instability. You might notice you get hangry easily. You need to eat frequently to maintain your energy. You experience strong sugar cravings, or the opposite happens. Your blood sugar feels stable, but your fasting glucose or A1C tests come back elevated. This is insulin resistance, and it's intimately connected to fatty liver. When your liver stores excessive fat, it becomes insulin resistant. Your cells become less responsive to insulin signals. Your pancreas compensates by producing more insulin. Elevated insulin levels drive sugar cravings, hunger, and further fat storage. This creates a metabolic cascade where fatty liver, insulin resistance, and weight gain all reinforce each other. The particularly insidious aspect is that blood sugar instability can appear before full diabetes develops. You might be in this gray zone where your fasting glucose is slightly elevated, your energy crashes after meals, but your numbers aren't diabetic yet. This is exactly when intervention is most powerful and most beneficial. Eighth sign, hormonal imbalances that don't respond to typical treatments. For women, this might look like irregular periods, heavy periods, PMS that's getting worse, difficulty losing weight despite good diet and exercise. For men, this might look like lower testosterone, loss of muscle mass despite training, increased body fat, decreased energy. Your liver is the primary hormone processing center. It breaks down and eliminates hormones like estrogen, cortisol, insulin, and thyroid hormones. When your liver is sluggish or fatty, hormone clearance becomes inefficient. Hormones that should be eliminated hang around longer than they should, creating imbalances. Estrogen dominance develops. Testosterone gets converted to estrogen through aromatase enzyme activity, which is influenced by inflammation and liver health. The hormonal imbalances associated with fatty liver create a feedback loop. Hormonal dysfunction contributes to weight gain. Weight gain worsens fatty liver. Fatty liver reduces hormone processing. The cycle intensifies. These 8 signs represent your body's early warning system. They're not definitive diagnoses. They're signals that warrant attention, investigation, and intervention before irreversible damage occurs. The liver is remarkably resilient. It can regenerate. It can heal. But it needs the right conditions, the right support, and the right approach. So what can you do if you recognize these signs in yourself? The good news is that fatty liver is largely reversible, especially in its early stages. The approach is holistic, addressing multiple interconnected systems simultaneously. First, reduce the toxic load on your liver. This means choosing organic foods to minimize pesticide exposure. It means filtering your water to remove contaminants. It means avoiding processed foods with artificial additives and preservatives. It means being mindful of medications and supplements that add burden. Every toxin your liver doesn't have to process is energy it can direct toward repair and regeneration. Second, support bile production and flow. Bile isn't just for fat digestion. It's also a major elimination pathway for toxins. Your liver makes toxins water-soluble and combines them with bile acids, then excretes them through bile. When bile flow is sluggish or insufficient, toxins can recirculate, creating additional burden. Support bile production through bitter foods like arugula, dandelion greens, and bitter herbs. Support bile flow through regular movement and hydration. Third, optimize your nutrition to support liver function. Cruciferous vegetables like broccoli, cauliflower, kale, and Brussels sprouts contain compounds that enhance phase 2 liver detoxification. Sulfur-containing foods like garlic and onions support the liver's detox pathways. Antioxidants like vitamin C, vitamin E, and glutathione precursors protect liver cells from oxidative damage. High-quality protein provides the amino acids your liver needs to build detoxification enzymes. Fourth, support your mitochondria, your cellular energy factories. Your liver contains more mitochondria than any other organ because it has high energy demands. When mitochondria function poorly, liver cells struggle and fatty liver accelerates. Support mitochondrial health through B vitamins, magnesium, coenzyme Q10, alpha-lipoic acid, and regular movement. Movement not only increases mitochondrial density and efficiency, it also improves insulin sensitivity, which directly benefits fatty liver. Fifth, address insulin resistance comprehensively. This isn't just about limiting sugar, though that's certainly important. It's about stabilizing blood sugar through strategic meal timing, adequate protein, healthy fats, and nutrient-dense carbohydrates. It's about intermittent fasting or time-restricted eating to give your liver metabolic rest. It's about building muscle through resistance training, because muscle is your largest glucose storage site and most significant insulin-sensitive tissue. Sixth, support your elimination pathways. Your liver works in concert with other organs. Your kidneys filter what your liver processes. Your lymphatic system transports cellular waste for elimination. Your gut microbiome influences what your liver needs to handle. Hydration supports kidney function and overall elimination. Movement supports lymphatic flow. Probiotics and fiber support gut health, which reduces the toxic load sent to your liver. Seventh, manage stress comprehensively. Chronic stress elevates cortisol, which promotes fat storage in the liver, particularly visceral fat around organs. Stress also increases inflammation throughout your body, which directly contributes to fatty liver progression. Techniques like meditation, breathwork, adequate sleep, and stress-reducing activities aren't just nice-to-haves. They're essential for liver health. Eighth, consider targeted supplements that research suggests may be beneficial. Milk thistle has been studied for its potential to support liver cell regeneration and protect against liver damage. N-acetylcysteine is a glutathione precursor that supports the liver's primary antioxidant. Alpha-lipoic acid can help reduce inflammation and support mitochondrial function. But remember that supplements are adjuncts, not replacements for foundational lifestyle interventions. Ninth, understand that hydration and water quality matter. Your liver is about 70% water, and liver cells are particularly sensitive to dehydration. Filtering your water to remove heavy metals, chlorine, fluoride, and pharmaceutical residues reduces the toxic burden with every glass. Caffeine and alcohol are diuretics, so when you consume them, you need even more water to maintain adequate hydration for optimal liver function. 10th, prioritize sleep quality because your liver does much of its repair work during sleep. Growth hormone and melatonin, released during quality sleep, help repair liver cells and protect against damage. 7 to 9 hours of quality sleep isn't just about feeling rested. It's about giving your liver the time to repair and regenerate. Now, let me address meal timing and strategic eating for liver support. When you eat matters as much as what you eat. Intermittent fasting or time-restricted eating gives your liver metabolic rest. During those non-eating periods, your liver can focus on repair and processing stored toxins, rather than constantly dealing with incoming food. Starting your day with protein and healthy fats, rather than carbohydrates, stabilizes blood sugar and reduces the insulin spike that promotes fat storage in the liver. When you begin with protein, your liver gets signals for stable energy production rather than sugar spikes and crashes. And timing nutrients strategically makes a difference. Bitter foods before meals stimulate bile production. Eating antioxidant-rich foods with meals protects your liver cells from oxidative damage during metabolic processing. Exercise specificity also matters for liver health. Aerobic exercise improves insulin sensitivity and can help reduce liver fat. Resistance training builds muscle mass, which is your largest glucose storage site and most significant insulin-sensitive tissue. Walking after meals supports liver function by improving insulin sensitivity in the immediate post-meal period when your liver is processing nutrients. Twisting and rotational movements like those in yoga or Tai Chi actually stimulate blood flow through your liver, creating a pumping effect that enhances circulation and bile flow. The connection between your gut microbiome and your liver health is profound. Your gut bacteria influence what your liver has to process. Unhealthy gut bacteria produce endotoxins that your liver must detoxify. When your gut is inflamed or imbalanced, these endotoxins flood your liver through the portal vein, creating chronic inflammatory burden. Supporting your gut microbiome through probiotics, prebiotics, and fermented foods reduces the toxic load sent to your liver. Soluble fiber binds toxins in your gut and helps them exit through stool rather than being absorbed and sent to your liver. Now, I want to emphasize something crucial. Reversing fatty liver and supporting liver health is a process, not an event. Your liver didn't become fatty overnight, and healing takes time. Consistency is far more important than perfection. Start with what's manageable for you. Build sustainable habits. Make one change, then another, then another. Be patient with the process. Initial changes might be subtle. You might notice slightly better energy after a few weeks. Your digestion might improve gradually. Your skin might clear slowly. These are signs that your liver is starting to function more optimally. Trust the process. Support your body consistently. Give your liver the conditions it needs to heal. This brings me to a broader perspective about liver health that's important to understand. Your liver doesn't operate in isolation. It's deeply interconnected with every other system in your body. When you support your liver, you're simultaneously supporting your hormonal balance, your energy levels, your digestion, your immunity, your inflammation response, your detoxification capacity, and your overall vitality. This holistic perspective is crucial because it means that when you recognize these 8 signs and take action, you're not just addressing symptoms, you're addressing root causes. You're creating shifts in fundamental biological processes that ripple through your entire physiology. Energy improves because your liver can fuel your cells properly. Brain fog clears because toxins are being filtered effectively. Digestion improves because bile production becomes optimal. Weight management becomes easier because insulin sensitivity improves. Inflammation reduces because your liver's inflammatory signaling normalizes. The choice to support your liver is essentially a choice to optimize your entire metabolism, your entire hormonal milieu, your entire detoxification capacity, and your entire health trajectory. And here's what's truly empowering about understanding these signs. You have agency, you have information, you have the ability to recognize when your body needs support and to provide that support. You don't have to wait for a diagnosis of advanced fatty liver disease or liver damage before taking action. You can listen to these early warning signs and respond proactively. The body is always communicating. These 8 signs are your liver's way of asking for help. The question is whether you're listening and whether you're willing to take action based on what you're hearing. Your liver is the workhorse organ. It's doing more metabolic work than any other organ. It deserves support. It deserves respect. It deserves care. When you provide that support, that respect, that care, your entire system benefits. Your energy stabilizes. Your digestion normalizes. Your hormones balance. Your inflammation reduces. Your mental clarity improves. Your skin clears. Your weight becomes easier to manage. All because you listened to those early warning signs and gave your liver what it needed to heal and function optimally. This isn't about fear or alarmism. This is about empowerment through awareness. When you understand what your body is trying to tell you, you can take informed action. When you recognize these signs early, you can intervene before damage becomes irreversible. When you support your liver comprehensively, you're supporting your foundational health infrastructure. But let me address one more critical aspect that most resources overlook: the psychological and emotional components of liver health. Chronic stress and unresolved emotional trauma can manifest physically in your liver. The connection between your emotional state and liver function isn't just metaphorical, it's physiological. When you experience chronic stress, your adrenal glands produce cortisol. Elevated cortisol promotes fat storage in the liver, particularly visceral fat around organs. Chronically elevated cortisol also increases inflammation, which contributes to fatty liver progression. The stress response diverts blood flow away from your digestive organs, including your liver, impairing liver function during stressful periods. Unresolved emotional trauma and chronic negative emotional states can create physical tension that restricts blood flow to your liver. The diaphragm, which sits directly above your liver, becomes tight and constricted when you're in a chronic stress state. This physical constriction can literally squeeze your liver, restricting blood flow and bile flow. Working with breathing exercises, meditation, yoga, or other practices that address physical and emotional tension isn't just about feeling better mentally. It's about supporting liver circulation, reducing cortisol production, and allowing your liver to function optimally. The path forward is clear. Listen to these signs. Support your liver holistically. Be patient with the process. Trust your body's ability to heal when given the right conditions. Your liver is asking for help. The question is, are you ready to answer? Remember, you don't have to do everything perfectly or all at once. Pick 1 or 2 of these strategies that feel most achievable for you right now. Start there. Build consistency with those, then add another strategy when you're ready. Each change compounds on the others. You don't need to be perfect. You need to be consistent. If you recognize multiple of these 8 signs, it's worth discussing liver function testing with your healthcare provider. Standard tests include ALT and AST, which are liver enzymes. Elevated levels can indicate liver stress or damage, but fatty liver can exist for years with normal ALT and AST levels. These enzymes may not elevate until significant damage has occurred. More advanced testing can include ultrasound to visualize liver fat, or the fatty liver index, which combines multiple biomarkers. But don't wait for lab values to tell you something is wrong. Listen to your body's signs. Early intervention is far more powerful than waiting for a formal diagnosis. Research suggests that meaningful improvements in liver fat can occur within 3 to 6 months with consistent lifestyle changes. Some people see improvements in energy and other symptoms within just a few weeks. Full reversal can take 12 to 18 months or longer, depending on severity. Your liver didn't become fatty overnight. The healing process takes time, but every positive change you make supports your liver, and you'll likely notice improvements in how you feel before advanced testing might show changes. The 8 signs we've discussed aren't just symptoms to manage. They're communications from your body about what it needs. They're your liver's way of asking for support before damage becomes severe. By listening to these early warning signs and responding holistically, you're not just preventing disease, you're optimizing function, you're creating vibrant health. Important medical disclaimer. The information provided in this content is for educational and informational purposes only. It is based on scientific research, expert knowledge, and holistic health principles gathered from various sources. However, this information does not constitute medical advice, diagnosis, or treatment, cannot replace professional medical consultation, should not be used as a substitute for qualified healthcare, may not be appropriate for your specific health condition. Critical requirements. Always consult with qualified healthcare professionals before making health decisions. Seek immediate medical attention for urgent health concerns. Discuss any health changes or new symptoms with your doctor. Ensure any supplements or lifestyle changes are appropriate for your individual situation. Consider your personal medical history, current medications, and health status. Limitation of liability. The authors and publishers of this content assume no responsibility for any adverse effects or consequences resulting from the use of any information, suggestions, or procedures described herein. Individual results may vary, and health outcomes depend on numerous factors beyond the scope of this content. Professional medical care. This content encourages and emphasizes the importance of maintaining regular contact with qualified healthcare providers for proper medical care, diagnosis, and treatment of any health conditions.